GLP-1 medications, lipedema, and lymphedema. What is the emerging research showing? There's some cool new ones I'm going to tell you about. I'm Jessica Brown. I'm a nutritionist, author Beyond the Shot and The Loving Diet. So can GLP-1 medications help either? It is an interesting question because lipedema and lymphedema can definitely overlap. Lipedema is a chronic condition involving disproportionate accumulations of fat, usually in the legs and arms, and it's often accompanied by pain, tenderness, bruising, and swelling. Lymphedema is swelling that occurs when the lymphatic system isn't adequately moving fluids out of the tissues. But people with lipedema can develop lymphatic dysfunction alongside it, and so that's why I wanted to bring both of these into this conversation. In a 2026 study published in the journal Obesity Pillars, they surveyed 2,700 people with diagnosed or suspected lipedema. And the current GLP-1 users that they looked at in that group experienced less pain, less swelling, less functional limitation than the people who had never used these medications. Interesting to note that nearly 1 in 5 said they were using the medication specifically for lipedema symptom management. Because this was a patient-reported survey, it was not a double-blind study, it cannot prove that GLP-1s cause those improvements. Now let's look at the lymphatic research. 2024 study published in Frontiers in Pharmacology, they followed 3,800 cancer patients who had undergone lymph node dissection. Lymphedema developed in 6.6% of GLP-1 users compared to 28% of non-users. And so after the adjustment, GLP-1 users had about 86% lower odds of developing lymphedema. That's pretty significant. And the third study is this year, a systematic review published in the British Journal of Surgery specifically looked at GLP-1 medications and lymphedema. The studies they looked at showed reduced limb volume and improvement in lymphatic imaging. And the last thing is at the annual meeting of the American Society of Clinical Oncology this year, researchers presented a real-world analysis of more than 61,000 breast cancer patients. GLP-1 use was associated with a 63% lower risk of developing post-mastectomy lymphedema. Don't forget, these findings are just abstracts, observational data, not randomized clinical trials. So we cannot say GLP-1 medications are proven treatment. And what does it mean? People are having less pain in their body, less swelling, lower limb volume, potentially better lymphatic outcome. So do you suffer from either of these conditions? And are you on a GLP-1 medication? And have you noticed an improvement? Love to hear.